LucidQuest Neuroscience Strategic Roundup, covering developments from June 17 through July 21, 2026. This reporting period highlighted a shift in neuroscience competition, from proving therapeutic efficacy to designing treatments that better fit the realities of long-term care. Across multiple neurological disorders, developers increasingly differentiated their products through delivery methods, dosing schedules, disease stage expansion, and implementation strategies, rather than efficacy alone. The market is evolving towards solutions that reduce treatment burden while improving access and supporting adoption in routine clinical practice. 4 themes stood out during this reporting period. The first theme was the growing importance of treatment delivery as a competitive differentiator. The approval of subcutaneous initiation dosing for lecanemab introduced greater flexibility for early Alzheimer's disease by reducing dependence on infusion centers and enabling treatment in more convenient settings. Cemdisiran reinforced this trend with a proposed once every 12-week subcutaneous schedule in generalized myasthenia gravis. These developments suggest that administration burden is becoming part of the therapeutic value proposition, particularly in specialist care settings where capacity remains constrained. However, it remains uncertain whether greater convenience will translate into improved persistence, broader patient access, or meaningful payer recognition, particularly as monitoring requirements and reimbursement considerations continue to influence uptake. A second major theme was the expansion of therapies into broader and later-stage patient populations. European approvals in secondary progressive multiple sclerosis without recent relapses and expanded eligibility for gene replacement therapy in spinal muscular atrophy illustrate how developers are extending established platforms across the disease continuum. These strategies may create new commercial opportunities while addressing areas of significant unmet need. At the same time, long-term durability, treatment sequencing, affordability, and national reimbursement decisions remain critical uncertainties that will determine the ultimate impact of these launches. The third theme was renewed competition in neuropsychiatry through differentiated mechanisms of action. Ecopipam advanced toward potential commercialization in pediatric Tourette syndrome with a selective dopamine D1 approach, while centanafadine demonstrated encouraging Phase 3b results in adults with ADHD and comorbid anxiety through broader monoamine activity. These programs reflect a shift toward more tailored therapeutic profiles, rather than incremental improvements within established classes. The key question now is whether mechanistic novelty will translate into clear clinical advantages that physicians, patients, and payers recognize in everyday practice. Comparative evidence, long-term safety, and prescriber confidence will be important watchpoints. The final theme involved the continued evolution of Alzheimer's disease strategy beyond amyloid alone. Subcutaneous lecanemab and new real-world evidence strengthened the implementation pathway for an established anti-amyloid therapy, while diranersen provided an early signal that targeting tau may represent a viable second disease-modifying strategy. Together, these developments suggest the field is expanding from improving access to existing therapies toward validating complementary biological approaches. Even so, questions surrounding Phase 3 dose selection, endpoint design, and replication of the clinical findings mean the long-term role of tau-directed therapy remains uncertain. Looking ahead, we will be watching final regulatory decisions for centanafadine and cemdisiran, early European adoption of tolebrutinib, and the influence of liver monitoring requirements, reimbursement and sequencing decisions for expanded SMA gene therapy, real-world adoption of at-home lecanemab initiation, and the design choices for diranersen's Phase 3 program. The key takeaway from this reporting period is that neuroscience competition is increasingly defined not simply by whether therapies work, but by whether they can be delivered efficiently, reach broader patient populations, integrate into routine care, and sustain long-term adoption in an evolving healthcare landscape. Thank you for joining this edition of the LucidQuest Strategic Roundup. For more healthcare market intelligence and strategic analysis, visit www.